Good afternoon, everyone. Welcome to my page, Dr. Rekha Sehgal, Homeopathy for Mankind. A big thank you to everyone for supporting my videos. Today, I am uploading my video on a very important topic, which is very common in your clinical practice, that is arthritis, that is inflammation of joints. It could be larger joints or small joints or singular joints, and the patient could present to you with a clinical presentation of pain at that area, sometimes swelling, redness, or any kind of nodular growth, or sometimes the cases with a lot of deformities. So, as you all know, arthritis is a very vast term, and there are almost about 20 kinds of arthritis which is found in medicine. And we are not going to specify every arthritis. Basically, we are concentrating our therapeutic approach on osteoarthritis, rheumatoid arthritis, gout, and fibromyalgia. So, first of all, what kind of risk factors those people are prone to have this complaints? The first and foremost is that when you inquire in your case taking, there will be a history of family histories there. That is, the patient, those who are having in their family this common arthritis problem, so they are predisposed to this kind of ailment. The second is the obesity. Obesity is one of the very important contributing factor for the arthritis, especially osteoarthritis. The third kind is there could be a history of any injury to that joint, or there could be a fractures which is making that joints weak. So while taking your case history, you can inquire. Or there could be autoimmune disorders, because of which there is a complication. The patient is developing arthritis, as like in systemic lupus erythematosus, or rheumatoid arthritis, or psoriasis. So, our being an homeopath, we have to take in depth the clinical case taking regarding this problem. So, usually in our case taking, we have to inquire step by step. We have to take a detailed case history, that the location of the joint is very important. Whether it is involving the small joints or a larger joints. Now, what kind of sensation you feel? Uh, you can inquire with your patients. There could be a numbness, or there could be a different kinds of pains, sometimes shooting pains, wandering pains, or numbness, tingling sensations. So while taking the case, you have to inquire. Or third is the modality. That is the characteristic indication when the pain is getting better, or when the pain is getting aggravated. Or some the next part is concomitant. Anything which is related with the joint, the other part is also involved. uh, Plus the mental state of the patient, which is very important, because I feel that mentals should be aligned with the physicals in order to select the similmema. So you have to be very thorough in your case taking and approaching the case of arthritis, in which category it falls, and how you will individualize it by taking a proper location, the sensation, the modality, and the concomitant. Now we will concentrate upon the homeopathic part, which is a very essential part. I'll be describing some of the remedies which I have used and have given a very good results, but they are not the key. They are not the only medicines for arthritis. You have to correlate with your case and individualize it, and then prescribe the minimum. Like in I have described that in this cases you have to take the proper location, the sensation, the modality, the concomitant. The concomitant could be at the level of the mind also, and at the level of the physicals also. For example, location, if the pain is located to smaller joints, then there are remedies like colophyllum is there, actis peccata is there. And if the pain is covering the larger joints, the rustox is a very good medicine which can be prescribed. The sensations, the very kind of sensations of pain, sometimes the wandering pains, they are shifting from one position, the pulsatile is there. Then while taking the case, you can have, and the patient could give you the history that the pain is traveling from downwards to upward, that is in lead impal, or they could be from upward to downward, especially in calmia latifolia. The third is the kind of sensation. There could be a tingling and numbness, which you find in rustox, very evident in rustox. And sometimes with this, you can find a lot of weakness is there, and the patient is very weak, and there is a stiffness or you can say paralysis also. Sometimes the mobility of the joints are affected. Then the causticum is a very good remedy for chronic problems. Then the modalities play a very important role in this, and in your cases you have to inquire the when the pain is getting better and how the patient is getting better with the complaint, or how the patient's complaints are aggravated. Concomitant, there are many medicines along with this arthritis. The patient could have many other complaints associated, with, like in calmia, it is associated generally with the heart complaints. Then lycopodium, a lot of flatulence is there, the digestive issues there. Antimcrude, you will find a lot of along with this, the patient will have a lot of vomiting part is there. So while taking the case, you have to specify how you will individualize your case of arthritis, because the common presentations is the pain, swelling, the stiffness, and in chronic cases you can find the nodulars, deformities. So you have to be very thorough with the knowledge. And there could be a in these cases there could be an acute state also, when the patient is having an the problems in bit of 2 or 3 days, or could be a weather aggravation, or could be an exertional or occupational hazard is there, or there could be injuries there, any injuries there, fractures are there, that could have resulted to this problem. Or in sometimes there is in a chronic state, in chronic state how the patient will approach to you, and the how what kind of presentation he will give you. Now let's come to the therapeutic approach, which is very important. I have tried to summarize in 7 or 8 remedies, but there are many more remedies, and you have to be very thorough with your case taking, and the entry points for the during the case to individualize it. So first remedy which I am going to discuss is that is arnica. Arnica is a medicine. It's a very good medicine where the essence is that there is a lot of fear of being injured, and the patient doesn't allow you, when he or she is coming, he will not allow you to examine his joints. There will be a lot of he will be in lot of trouble state. He will not make you examine the joints. And there could be an history. Another kind of the presentation is that the overexertion, overuse of the knee joints, that could have resulted to this pain. And the pains are always aggravated by any kind of exertion, and it is always better by rest. The next remedy is an apis. This remedy is especially useful in cases of gout where there is an acute inflammation, and you will find a lot of redness is there, the burning pains are there. And along with this, there is a lot of stinging pains are there. With this, the patient is always aggravated by anything warm application. He wants something cold. And when you inquire about other generalities, there could be a thirstlessness feature, the kind of is present in them. The third remedy is belladonna. Belladonna, as you know, it is used for any acute phase of the problem, and there will be a lot of shooting pain is there. The joints are very red, hot, and swollen. The patient will be very you can say with its trouble, he's very in a panic state. The next remedy is Rustox. Rustox is a very good remedy for where there's an aggravation from damp weather or getting chilled, and it affects the larger joints basically. And along with this, the key point for rest is the restlessness. You will find that the specific modalities, whenever there is an initial motion, the patient is having a lot of trouble, and once better by a continued motion. So he wants to be in motion. In order, if you inquire about the sleep, the patient will say that he or she is keep on tossing in the bed because of pains. So the entry of the Rustox will be like this. Then the remedy is pulsatilla. Pulsatilla is a very good remedy for the cases where the pain is not specified to one joint. It is from one shifting from one joint to other joint. And there is also modality that the patient is aggravated by warm. Why I'm specifying upon the modality? Because modality gives you a very clear, will individualize your case, and you will get a clear picture of your remedy. Then in pulsatilla, you will have a lot of aggravation from the warm, and whenever the patient is better in the open air. The next remedy is bryonia. Bryonia is a very good remedy where you will find a lot of stiffness is there, and the side is especially it is basically it is for right-sided complaints. It is not specified, but I have seen many cases where right-sided involvement is there, and the patient is aggravated by a slightest motion. Even the slightest motion cannot be tolerated by him, and always better by warmth or you can say rest. Then there are remedies which affects especially the smaller joints like actis spicata, which is basically for the small joints of the wrist. Then the colophyllum is there, where the joints are affected and the pain is very treble. It is causing madness in the patient because of these pain. Then there is a very good remedy that is called Leadum Pal, which is given where the patient always give you the travel of the symptoms is from the downwards to upward, and basically it is a good remedy for the gout problems. Now there are certain indication for other remedies like causticum. Causticum is a remedy which is given for chronic arthritic problems, and you will find that the patient is having a trouble for many years, and there's a lot of stiffness, weakness of the that weakness is there, and the deformities of the joint is very evident. Then benzoic acid, along with this joint problem, you will have the urinary complaints also, the offensive smell of the urine, which will indicate the benzoic prescription. Then there are mother tinctures which are very important, like Urtica urins. I have used in many cases and have given the very good result. It is case given in the cases. It not only reduces the complaint of the because of this arthritis, but also eliminates the excess of urate, especially in cases of gouts. And I have prescribed in mother tincture form. Then there is another medicine which is Goltria. It is a very good medicine. It all the inflammatory complaints related to this problem can be cured, can be arrested. Then there is a remedy, Formica rufa. This is also for rheumatism, chronic rheumatism, and the pains are very severe. Then there is a remedy called Formica rufa is there. And in short, I have tried to give you a gist that ammonium phos is there. This remedy is given especially in the cases where there's a lot of deformities of the joint, especially in RA cases. So, as I have given you a brief description about this problem, but I would like to that take your case in depth, take it in the form of location, sensation, modality, concomitant, and if any mentals which are very peculiar, you can take in your case. And then there is a lot of lifestyle modification which could help you to some extent in combating this problem. Especially first is the control the weight. Weight is very important part. I have tried to advise my patient, those who are overweight, obese, to reduce their weight. Second, the dietary factor. You should consume the diet which is rich in calcium. Avoid processed fatty sugary foods, because ultimately they will put on your weight. Then I would take care of your joints properly and do regular exercise in a very milder form, and don't try to overexert your joints, and don't try to fix your joint in a particular position for a long time. Take a break. And last and foremost is that in homeopathy it has got a wonderful results. I have treated many cases of arthritis where the patient is completely dependent upon the painkillers, the steroidal treatments, and along with this problem they are having a lot of complications because of these drug intake. So, in short, I have tried my level best to describe the. I hope this video is helpful for you. I want to make another announcement that I'll be going live on my page. Where I'll be taking up, because a lot of patients have requested me to speak about a very common problems of the females, and it will be an awareness program. If you have any problems, you can interact it, or you can. I have provided online consultations also. So we will be going to meet you soon, and thank you and have a nice day. Thank you.